Pain, not death, is the enemy of mankind. And once you learn about Prudden Myotherapy, you won't have to worry about living with pain. I'm Lori Drummond, certified Prudden Myotherapist, and Dottie is going to help us teach you how to erase knee pain. Most general knee pain comes from the two muscle groups, one in the front of the thigh and one in the back of the calf. We're going to start in these large quadricep muscles. And if you were a kid and somebody squeezed you on the knee and yelled horse bite and made you jump, that's about where we'll be using our guidelines for trigger points in the quadriceps. We'll start with where your finger would be, right on the outside of the leg, just above the knee. We're going to use our elbow. Put your elbow down, roll over onto your point, get your shoulder forward, and relax into it. You're looking for a point that's sensitive, and on a scale of 1 to 10, you don't want to go over a 7, so you always have to get feedback from the little body underneath you. And you're holding for about 7, which is about how long it takes to diffuse that point. From here, we're going to use that groove, follow that groove as your guideline, right up the outside of the leg, elbow down, roll over, get your shoulder forward of your elbow. That's what makes your point angle back towards the center of your leg so that you can lean into it instead of having to pull back towards the center line. And we'll hold that for about 7 seconds. There's nothing magical about 7, but that's about what it takes to diffuse the points. Now this muscle is coming up towards the center of the leg, so as we're working our way up, we're going to work more towards the top of the leg and towards the center. So elbow down, roll up onto the point of your elbow, get your shoulder forward, and just relax into it. Make sure your body sinks as a unit. Don't let your shoulder get hung up. That will put trigger points in your shoulders. Now, you always want to do both sides, even if only one side hurts. So from this side of the table, I have a good angle to work on the inside of her leg. I'm going to slide this leg out of the way for you so you can see what I'm doing. The inside of the leg, if we were doing horse bite, would be right about where your thumb would be. We did the outside, now we're doing the inside. So here's her knee. I'm going just above the knee, right on the inside. There's a nice little groove there. And again, as you follow that up the leg, it comes towards the center as you get towards the top of the leg. Start just above the knee, elbow down, roll over that edge of the muscle, get your shoulder forward, and it's almost like you're trying to hook under the muscle. Go ahead and press in. Hold that for about 7 seconds. These trigger points can cause pain in the knee, but because the muscles cross the hip joint, one of them does. Slide up for your next point. These can also contribute to pain in the hips and the low back. And work your way up as we come up to the top of the leg. Again, that muscle's curving towards you. Roll up, shoulder forward, relax into it. These trigger points are also important if you have varicosities to help get those muscles to let go so that they're not putting even more pressure on the vessels. Okay? To stretch this out, you would go around to the other side, do the outside of the faraway leg, the inside of the leg that's near you if you're standing on that side of the table. Then we'll stretch that muscle group. We're going to bring the knee towards the chest and give it a nice little bounce. The reason for the exercise is you're breaking that muscle's habit of shortening and going back into spasm. So you want to re-educate it. You want to break its habit by reminding it several times throughout the day. Aim for at least 5 to go through its normal resting length and give up that habit of shortening, which makes it more vulnerable to going back into spasm more quickly. Now, to get at the next muscle group, your calf, I'm going to have you flip over, face down, and we're going to work on the lower leg. I'm going to work on the leg near me, so for the video, so you can see what I'm doing, I'm going to slide her other leg out of the way, and we're going to start just below the knee. This is a nice, strong muscle in the lower leg, back of the lower leg. We're going to start below the knee, and we're going right down the middle of that muscle. The first one, put your elbow down. When you're working at home, make sure that opposite leg doesn't come up and kick you on the head. And let their feet slide over the edge of the table so that if they have a tight instep, you're not pushing down on the instep. Roll up, This time you're pretty much pressing straight down because we are in the center of that muscle. The first one may not be too bad, but as you slide down closer to the center of the leg, you'll find that these can be really tender. It's right where the two heads of that muscle come together. And just below that, this is that large gastrocnemius muscle. This muscle can contribute to knee pain, but also shin splints. Not where the shin splints are felt, but they contribute to the pain. They also have a lot to do with trouble going on in the bottom of the feet. Cramps in your calves, if you've ever woken up with cramps in your calves at night. Come back up to the knee, and we're going to go just to the inside edge of that muscle. Okay, put your elbow down just below the knee. Bring that muscle towards you. Now roll up onto your point and relax into it. These are usually pretty tender here. If you wear heels, a woman wearing heels, this muscle is shortened, so you need to give these a stretch periodically throughout the day so they don't continue tightening, tightening, tightening. And if you ever had, keep working your way down, if you've ever had inflammation of the fascia on the bottom of your feet, a lot of runners have that, these are key points for that. And one more just above the ankle. Okay, to give these a stretch, we're going to bend the knee, and we're going to put your hand over the ball of the foot. You give that a nice, easy little stretch with a little bounce. Turn the foot out and give that a little bounce. That stretches the inside and straight ahead. We haven't done the outside, but if you were to do the outside, you would turn the foot in and give that a little bounce. Okay, these are just a few of the key trigger points that you would need to do to erase knee pain. For more complete information, please visit our website at bonnieprudden.com, where you'll find a list of our books, videos, DVDs, and our seminars, where you'll have more complete training. And as Bonnie would say, keep fit, be happy.